Welcome to the deep dive. Today we're taking a journey into something pretty vital and often misunderstood. The surprising ways stress really impacts our heart and our blood vessels. Our guide for this is Chapter 3, Stroke, Heart Attacks, and Voodoo Death, from Robert M. Sapolsky's brilliant book, Why Zebras Don't Get Ulcers. So our mission today is to really get our heads around this incredible paradox of our body's stress response. It's this amazing, life-saving system, perfectly tuned for a physical crisis like that zebra outrunning a lion. But what happens when that exact same powerful system gets triggered relentlessly, day in, day out, by chronic, often, purely psychological stuff? Think about the daily grind, a demanding job, maybe that endless to-do list. We're going to uncover some pretty profound insights into how what's designed to save us can, well, over time, actually wear down our most vital organs.
Precisely. And this deep dive, it's not just about what happens inside your body, but really why these physiological shifts are so incredibly significant. We'll connect your everyday anxieties, maybe frustrations, to powerful, sometimes silent changes within your cardiovascular system. We'll start by breaking down the body's dramatic, immediate response to acute danger. Then we'll shift into the long-term, often sort of hidden damage that chronic psychological stress inflicts. It's quite a journey, from survival mechanism to, well, an insidious threat.
Okay, let's dive in with a scenario. Imagine you're just walking down a quiet street, maybe thinking about dinner or whatever. Suddenly you turn a corner and bam, bam, dead to lion. Your body doesn't wait, right? In an instant, your digestive tract just clamps down, your breathing goes way up, production of sex hormones
Wow.
inhibited, and then this flood of powerful chemicals. You've got epinephrine, that's your quick adrenaline shot, norepinephrine, and then glucocorticoids. Those are the body's longer-term stress hormones. They just pour into your bloodstream. Your muscles are primed to sprint, and for that, your cardiovascular system has to go into immediate overdrive,
Right. Full emergency mode.
delivering oxygen and energy exactly where it's needed most. It's a real full-body emergency.
And that full body emergency translates into three really rapid, really crucial cardiovascular changes, all designed for immediate survival. First, your heart goes into high gear. Your sympathetic nervous system, it ramps up, while the parasympathetic system, that's the rest and digest one, it dials way down. This makes your heart beat much faster and pump far harder. I mean, most of us have felt that surge, right? In a really intense stressor, your heart's output can actually increase up to 5 times its resting rate, just sending blood roaring through your system.
Oh, 5 times.
Yeah. Second, your blood vessels undergo pretty dramatic changes. Think about it like a garden hose. If you want to spray water really hard, you don't pick a wide, soft, floppy hose. No, you choose a narrow, rigid one. It's similar here. Your sympathetic nervous system constricts some of your major arteries. There are these tiny circular muscles wrapped around them, and they just tighten up, dramatically increase your blood pressure.
Okay, higher pressure, faster flow.
Yeah.
Makes sense.
And third, there's a crucial redistribution of blood flow. Your body is smart. It diverts blood away from functions that aren't immediately critical for, staying alive right now. So vessels supplying your digestive tract, your kidneys, even your skin constrict. Blood flow slows down there. But simultaneously, blood flow to your muscles and your brain increases,
Yeah.
giving you the power to fight or run and hopefully the clarity to figure out which one. There was actually this remarkable observation way back in 1833. A Canadian Native American man had a tube in his abdomen for some reason, and observers could see his gut tissues, normally bright pink with blood, visibly turn white whenever he got anxious or angry.
Wow, you could actually see it happening.
Yeah, a stark visual of the body shifting priorities on the fly.
So the body has one more trick, right? Involving the kidneys.
That's right. Another crucial cardiovascular trick for emergencies, and it involves water conservation. Think about that zebra again. If it's bleeding or sprinting for ages in the sun, it's losing fluid fast and can't exactly stop for a drink. So conserving water becomes absolutely vital. Your brain sends a powerful signal to your kidneys, telling them to basically stop making urine and reabsorb that water back into your circulation.
Keeping the blood volume up.
Exactly. This is done by a hormone called vasopressin, also known as antidiuretic hormone. Keeps you from dehydrating and maintains blood pressure.
Okay, but wait. That brings up something I've always wondered. If the kidneys are saving water, why do people sometimes, wet their pants when they're terrified? Seems like the opposite.
Yeah, that's a common question. It seems contradictory, but the explanation is actually quite straightforward. It lies in the bladder versus the kidneys. Kidneys are complex. They actively regulate water. But once urine leaves them, it goes to the bladder, which is basically just a simple one-way storage bag. In a life-or-death sprint, what good is a full bladder? It's just sloshy dead weight. So in that critical moment, emptying it, while maybe embarrassing later, is actually a practical move by the body. Lighten the load.
Huh. Never thought of it that way. It's purely about efficiency and crisis.
Pretty much primal programming.
And that leads to another important point, right? Not all stress looks exactly the same to the body.
That's exactly right. There's a crucial nuance here.
Yeah.
Not all stressors trigger the identical response. Think about a gazelle, maybe crouching totally still in the grass while a lion walks past nearby. That's a different kind of stress. It requires vigilance, readiness for an explosion of movement, but also absolute stillness right now. In that kind of scenario, things like heart rate and blood flow might actually slow down, and vascular resistance can increase everywhere, even in the muscles. It highlights this idea of stress signatures. The body's response isn't just one size fits all. It's tuned to the specific threat.
Okay, so you've survived the lion, thanks to this incredible acute system. But now, here's the twist, the paradox we talked about at the start. What happens if you put your heart, your blood vessels, your kidneys through that kind of intense workout every single time your teenager pushes your buttons, or you get stuck in traffic, or you just misplace your keys? Your heart, it's basically a simple mechanical pump, right? And your blood vessels are just hoses, essentially. They are not designed for that constant psychological overdrive. If you run them at maximum capacity all the time, they're going to wear out.
That's the core problem. And this wearing out, it happens most notably through something called atherosclerosis. You've probably heard of it as hardening or clogging of the arteries with fatty plaques. A key factor here is just the plumbing, the architecture of your circulatory system. Large blood vessels, like your aorta, they keep splitting into smaller ones. That branching process is called bifurcation.
Okay, where they split.
Right. And those branch points, they're particularly vulnerable. When you have chronically elevated blood pressure, the increased turbulence and force of the blood flow, it essentially slams into those branching points. It causes microscopic damage, tiny scrapes on the smooth inner lining of the vessel.
Like little injuries inside the artery walls.
Exactly. And once that smooth lining is damaged, it becomes kind of like sticky. The fatty acids and glucose, which are already floating around in higher amounts because of the stress response, they start to work their way under that damaged lining. They accumulate, thickening the vessel wall. Stress also makes platelets, those little blood cells involved in clotting, more likely to clump up at these damaged spots. Then the specialized cells, called foam cells, basically cells filled with fatty stuff, they join the party. Before you know it, you get these plugs, or plaques, building up, made of fats, cellular debris, starches, and they start narrowing and clogging your vessels, which of course severely decreases blood flow.
So the stress response itself kind of primes the pump for this clogging process just from chronic psychological pressure.
That's a good way to put it. It creates the conditions for this internal rusting and clogging.
Wow. And there's actual evidence for this link between stress and clogged arteries, isn't there? Like those monkey studies?
Oh, absolutely. Some of the clearest, most compelling evidence comes from the physiologist Jay Kaplan's work with monkeys. Really groundbreaking stuff. He found that in stable social groups, monkeys who are consistently at the bottom of the pecking order, the ones with little predictability, little control, they also developed significant atherosclerosis. They showed all the signs of chronic stress.
So low status itself was stressful enough to cause physical damage.
Yes, but Kaplan didn't stop there. He also looked at unstable social groups, where the hierarchy was constantly shifting, monkeys always fighting for position. And in those groups, it was often the animals scrambling to hold on to the top spots, doing the most fighting, constantly defending their status, who showed the highest stress levels and really massive atherosclerosis. Some even had heart attacks.
So it wasn't just being low status, it was also the stress of maintaining high status in an unstable situation.
Precisely. And he found this powerful synergy too. Social stress alone caused plaque, even if the monkeys were on a low-fat diet, because, the fat often comes from the body's own stores mobilized by stress. But if you couple that social stress with a high-fat diet, plaque formation just went through the roof, as Sapolsky puts it.
That's huge. So it's not just diet, it's the interaction with your life stress.
Absolutely. And Kaplan linked this directly to an overactive sympathetic nervous system. He called these monkeys hot reactors. He even showed that drugs blocking that sympathetic activity, like beta blockers, could prevent the plaque, while stress hormones, the glucocorticoids, actually made it worse.
So bringing this back to humans, the implications are pretty profound. This plaque buildup, this atherosclerosis, what does it lead to?
Well, it leads to obstructed blood flow. If it happens in the arteries supplying your legs or chest, it can cause significant pain, might eventually need bypass surgery. If it affects the coronary arteries, the ones feeding the heart muscle itself, you can develop coronary heart disease. This can lead to myocardial ischemia, which basically means your heart muscle isn't getting enough oxygen and glucose.
Ischemia, lack of blood flow.
Right. Think of it like this. Your heart is surrounded by blood, but it can't use that directly. It needs its own dedicated arteries, like workers at a water reservoir drinking from a specific water fountain, not the reservoir itself. If those fountain posts get clogged, the heart muscle suffers.
And if the vessels supplying the brain get clogged?
That's when you risk a stroke.
Okay, so here's a crucial question then. What happens if someone already has this chronic myocardial ischemia, their heart arteries are already a bit clogged, and then they encounter another big acute stressor?
This is where it gets really dangerous. It's a nasty paradox. In a healthy heart, when you face acute stress, those coronary arteries are supposed to dilate, open up wider to deliver more oxygen and fuel to the hardworking muscle.
Makes sense. More demand, more supply.
But if your heart is already compromised by chronic ischemia, if those arteries are already narrowed and damaged, something different happens. Instead of dilating, they actually vasoconstrict. They narrow even further.
Wait, so just when the heart needs more blood?
Exactly. Just when it needs more blood flow through those already partially clogged vessels, acute stress shuts them down even more. And that's often when people experience that intense chest pain, known as angina pectoris.
That sounds incredibly dangerous.
It is. And a really interesting discovery came about with the development of miniature ECG machines, electrocardiograms, tracking heart activity that people could wear around during their normal lives. Ambulatory ECGs. Cardiologists were pretty surprised by what they found. People at risk were having numerous silent ischemic crises, episodes where their heart muscle wasn't getting enough oxygen, often triggered by purely psychological stressors like public speaking, a tough interview, even an exam.
Silent, so the person didn't even feel it.
Often, no. Or maybe just mild, vague discomfort they didn't recognize. The old thinking was mainly about physical exertion, triggering problems in heart patients. But this showed that everyday psychological stress can be causing these dangerous silent events, really highlighting how vulnerable a damaged cardiovascular system becomes.
Which brings us to the most catastrophic outcome, sudden cardiac death.
Yeah.
We've all heard stories, maybe know people, situations where incredibly shocking news, terrible news like a spouse dying, losing a job, but also incredibly joyful news like a lottery win or a lost child returning can lead to sudden collapse. The person might gasp, hyperventilate, clutch their chest, and just fall dead.
It's a very real phenomenon, and sadly, well documented. You can find accounts going way back, even in historical texts. Modern studies clearly link sudden cardiac death to acute events like grief, triumph, extreme joy, loss of status. There was a stark example during the 1991 Persian Gulf War. More elderly Israelis actually died from sudden cardiac death, likely due to the intense fear and anxiety of missile attacks than from any direct war injuries.
Wow.
Cardiologists now understand this often involves ventricular fibrillation. That's where the heart's main pumping chambers, the ventricles, just start quivering chaotically instead of beating effectively. It's often triggered by disorganized signals from the sympathetic nervous system, and it's much more likely if the heart tissue is already damaged. Though, puzzlingly, it can sometimes happen in seemingly healthy people too.
You mentioned joyful news possibly triggering it too, these fatal pleasures. That seems so counterintuitive. How can extreme joy kill you like extreme grief? Isn't stress supposed to be stressful?
It's a profound point about how the cardiovascular system works. In some ways, it doesn't really care why homeostasis, that stable internal balance, is being massively disrupted, only how much it's being disrupted. Think about it. Extreme rage and extreme joy might have totally different effects on, say, your immune system or reproductive hormones. But the sheer demand they place on your cardiovascular system can be remarkably similar. Wailing in grief, jumping up and down, shouting with ecstatic joy both can put enormous strain on an already diseased heart. Your sympathetic nervous system basically fires up with similar intensity. Both are huge acute challenges to the system's stability.
The heart just feels the strain regardless of the emotion behind it?
Pretty much. The intensity is the key factor for the cardiovascular system.
Okay, now for something really fascinating, almost unbelievable. Voodoo death. The idea that someone in a traditional society gets hexed by a shaman and then, shortly after, just drops dead.
Right. It's an extraordinary phenomenon. Ethnobotanist Wade Davis and cardiologist Regis De Silva looked into this, preferring the term psychophysiological death to be more respectful and accurate. They acknowledge, of course, there could be other factors. Maybe the shaman is just good at spotting people who are already critically ill. Maybe there's actual poisoning involved. Or maybe, as Sapolsky notes somewhat humorously, The community just stops feeding the hexed person.
Right, gotta rule out the obvious explanations.
But assuming there are genuine cases, there's been debate among physiologists about the mechanism. Walter Cannon, the fight-or-flight guy, thought it was sympathetic overactivity. The person gets so worked up, their vessels clamp down so hard, blood pressure plummets fatally. Kurt Richter, another prominent physiologist, argued for the opposite. Massive parasympathetic activity, a vagal storm, essentially slowing the heart to a complete stop.
So too much fight or flight versus too much rest and digest.
Kind of. But Davis and De Silva concluded Cannon was likely closer. Hearts rarely just stop cold from vagal activity alone. It's much more probable that these are dramatic instances of sudden cardiac death, driven by that excessive sympathetic tone pushing the heart into fibrillation, especially if there's some underlying, maybe unknown heart damage.
But that still leaves a mystery, doesn't it? Because voodoo death is sometimes reported in young, apparently healthy people.
Exactly. That's the really compelling part. Does it mean there's more silent heart disease out there than we realize? Or does it speak to the incredible power of belief? The idea that if your culture, your community, and you yourself profoundly believe you were doomed, maybe that belief itself can trigger a fatal physiological cascade. If faith can heal, maybe, just maybe, faith can also kill.
That's a chilling thought. Okay, so we've seen these broad effects, but people react differently, right? Even to the same stress. Genetics play a role, existing health, but what about personality? Can who we are actually influence our heart health?
That's a huge area of research. And the answer seems to be yes. Personality does matter. Researchers have identified certain patterns. There's the Sisyphus pattern, for example, named after the mythological guy pushing the rock uphill forever. These are individuals who see life as just a joyless struggle. Maybe workaholics whose only satisfaction is ticking things off a list. They seem to be at higher risk for sudden cardiac death. Depressive personality types also show links to heart disease.
But the really famous one is type A, right?
Ah, yes. Type A coined back in the 60s by cardiologists Friedman and Rosenman. Their initial description was someone intensely competitive, always racing against the clock, impatient, overachieving, and crucially, hostile. Their first big study following healthy people over time suggested being type A was as big a risk factor for heart disease as smoking or high cholesterol. It made a huge impact. Type A became part of everyday language.
But the story got more complicated.
It did. Later studies, often more carefully designed, had trouble consistently replicating those dramatic initial findings. Some research even suggested that if someone already had heart disease, being type A might actually be linked to better survival rates, maybe because they were more driven in their recovery.
So the original definition was maybe too broad.
Exactly. The picture became much clearer thanks to work by researchers like Redford Williams at Duke. They started breaking down the different components of type A. And what consistently emerged across many studies, many populations, lawyers, Finnish twins, doctors, controlling for other risks like smoking, weight, age, was hostility.
Hostility, that's the key ingredient.
That seems to be the toxic element within that broader type A cluster. It's the cynical mistrust, the frequent anger, the easily provoked irritation. That consistent internal churn of hostility seems to be what really damages the cardiovascular system over time.
So it's not necessarily about being ambitious or time conscious. It's specifically that simmering anger and cynicism.
That appears to be the critical factor driving the risk.
Okay, but what aspect of hostility is it? Is it constantly blowing up at people? Or could it be, maybe paradoxically, the opposite, always feeling annoyed, but not expressing it, just bottling it all up? That feels like it would be incredibly stressful internally.
That's a great question. And the evidence seems to point towards the chronic physiological response that hostility triggers, maybe regardless of exactly how it's expressed outwardly. What studies show is that hostile individuals just tend to get all worked up, as Sapolsky says, over things that other people might find only mildly annoying. When researchers deliberately provoke people in lab settings, maybe interrupting them during a task, making them play a rigged video game against somewhat obnoxious hostile individuals, consistently show a much bigger physiological reaction. They dump more stress hormones like epinephrine and norepinephrine into their blood. Their blood pressure shoots up much higher and stays higher for longer, compared to non-hostile people facing the same provocation.
So they're having a bigger internal stress reaction to the same external event.
Exactly. It's like those hot reactor monkeys Kaplan studied. Their cardiovascular systems are just working much harder, much more often, in response to everyday annoyances. And over a lifetime, that constant hammering away at the heart and blood vessels takes its toll, significantly increasing the risk of heart disease.
Hearing about this individual variability, how some people react more strongly, while it might be frustrating for scientists looking for simple answers, it actually sounds like good news for us individually.
How so?
Well, if we can identify specific factors like this floating hostility that put certain people at greater risk, then that's the first step, right? Now we know what we might need to work on, what we can try to change.
That's a very positive way to look at it, and you're absolutely right. And encouragingly, some recent work does suggest that interventions aimed at reducing hostility in type A individuals, things like therapy or anger management techniques, can actually reduce their risk for further heart problems. It points to a broader, really hopeful theme in all of this. If we can understand what helps some people navigate stressful lives with better health outcomes, maybe we can learn to cultivate those protective traits ourselves.
So, as we wrap up this deep dive, let's bring it back to that core lesson, the cardiovascular stress response. It's brilliant, it's vital, it's life-saving, but it's designed for short-term, acute physical emergencies.
Hmm.
When that exact same powerful system gets triggered over and over by chronic psychological stress, the daily worries, the frustrations, the anxieties, those very same physiological changes start to become incredibly damaging, slowly, silently wearing down our heart and vessels.
So perhaps something to take away is to reflect on that difference between acute and chronic stress in your own life. How do you perceive and respond to the lions of your everyday existence? And maybe a final provocative thought to leave you with. If something like personality, like hostility, can have such a profound impact on our physical health, what other subtle psychological patterns, ways of thinking or feeling might be silently shaping your well-being, your longevity, in ways we're only just beginning to understand?
Thank you for joining us on this deep dive into stroke, heart attacks, and voodoo death. We really hope you've gained some valuable insights today. On behalf of the Deep Dive team, thank you so much for your curiosity and your time. We appreciate you listening.